male fertility in the sperm is that kind of window into overall health. Can you talk a little bit about how you see that as almost like a marker of how healthy the patient is otherwise?
Yeah. And I kind of was alluding to that just now, but basically, our fertility lies on a spectrum, right? Sperm cycle is about every 3 months. So a lot of the things you do one day can totally impact it, and then another day your sperm can change, and that's very different from the female body where you're born with a set amount of eggs. You can obviously impact your fertility in many ways, but your sperm is always being regenerated. And every time we take a screenshot of your fertility, which is a semen analysis, we're getting a glimpse into your current health status. Now, your fertility is an exact window into your overall health, right? It can be a sign of potential problems coming down the line or currently health issues. And when we're talking about fertility, we're usually dealing with younger men. And I think a lot of young men are not thinking about their health. They're thinking about living in the moment, enjoying themselves. They're thinking about having children potentially later down the line. But, we do know that things like diabetes, being obese, eating poorly, not taking care of yourself, poor sleep, these things can compromise your testosterone. They can compromise your fertility. And there's a lot of things that you can do to prevent those problems from coming down the line. I think it's very interesting where we see people, often they come into my office, couples, and they're like, we thought this was going to be easy. We had sex, we're educated. We're in school where we have sex 3 times. We were going to have a baby by now. And it just doesn't happen that way. And that's often, just because of expectations, right? We're literally told you have sex 1 time, you're probably going to get pregnant. And that's not true. So people act accordingly, right? And I think the key here is if you understand that your fertility is directly related to how you live, how you eat, any medical conditions that you're not addressing, you can actually improve your health, not only for yourself, but for your partner and for your potential future family. And I think that, that is so important to understand when men come in to address their fertility and the ways that we can counsel them to improve.